have to say that in a number of ways, Seattle was blessed. We had leading researchers and leading scientists and leading clinicians who were eager to study the subject, and some doctors eager to treat patients. And of course, as we know, there were some that weren't. And some companies that shied away from the issue altogether, and some, as we know, that took a real leadership in the community. And so for the leadership that was shown in several places in medicine and science and broadcasting, I'm really proud of our city and proud of our people. I got a job at King. They were hiring people who had reasonably good educations and seemed curious and a little creative. And there was one other woman in the newsroom and one reporter, and there was one secretary to the news director. And there were no pregnant women, which soon after I arrived, I was. So all of this, first female reporter, first pregnant person on the air, it was all, seems strange now because it's so frequent, but it was all new. And a lot of other things were new. As you get some traction and you get contacts and you develop your interest, mine definitely was health, community health. And so, when they said, go find out what AIDS is all about, we send you. So I didn't know any more than anyone else in the community knew at that point. There were stories along the way. What is this virus? Are there any treatments? Is there a cure down the road? What was the cause? So there were a lot of stories like that. But then I think I credit the leadership of King Television at that time. Our CEO said, this is not just a medical issue, this is a humanitarian issue, and we are going to deal with it in a very humane way. We're going to move ahead on the subject because it's affecting everyone in the community, whether you have AIDS or know somebody with AIDS, or just really want to understand and be part of the solution. So I think King took a real leadership position, and the boss said, you've done the stories, you go out and interview Carl Cobb, a man in our community who was a centerpiece in all the issues we were focusing on. Carl Cobb was a husband and a father of 5 and a pastor in his neighborhood church. And he came out to his wife very late in the game that he was gay. And shortly thereafter, he revealed to her and his children and to the community that he had AIDS. And at that point, I was assigned to spend days with him and find out what his life was like.
Fear has become almost as much an epidemic as AIDS itself.
As you well know, there was stigma and discrimination and shaming and blaming, and it became a humanitarian crisis as people separated from each other and pointed fingers at each other. I discovered that I was afraid, like other people were afraid. I mean, why are they sending me? I'm a young reporter. I'm a mom now of young children. Am I putting myself at health risk, or my children, my family? Is it all right to have coffee? Was it all right to sit and talk to him in his apartment for days on end? The same questions everybody had. And what I discovered was, as we all did, these are our friends, these are our neighbors, these are the people who need our care. I wasn't going through really much different from what a lot of people in the community were going through, who have friends and neighbors who had AIDS. What's our response? And the more I listened and I learned, as the whole community learned, I mean, I was safe. You're not going to get AIDS from talking to Carl, drinking coffee with Carl, walking around the block with Carl. You're not, and you're going to find a solution to all the social problems that arose. Like, people lost their jobs, people lost their homes, people lost their families, their own families in many cases shunned people with AIDS or people who were known to be gay, because if we can recall that time, there was a lot of discrimination against gays. And so as I go back to the beginning, that as your knowledge increases about what AIDS is and what people need, your fear decreases.
The AIDS virus is carried in body fluids. It is not spread by casual contact, not in a restaurant, not in a restroom, and not in the office.
When you spend that much time with somebody and you get to know the heartache that he felt, the pain that he felt he caused his family and his children. He was a wonderful man, and he himself was a supreme leader in the community by just being so open about his life and his choices and his impending death. There were so many services that had to be started, and we thought that a walk to raise money and awareness about AIDS and help people with AIDS would be a good way to raise money. And so we led the first AIDS walk in Seattle. We led the second one. There were many more walks to follow. Remember back to Seattle in the 80s, and we were in the forefront of medical research then, and we were in the forefront of humane treatment of people with a disease we at that point didn't understand. I think people really fear what they don't know. They sometimes fear people we don't know, diseases we don't know. So I think, you know, as you rightly say, there is a parallel between the times we were facing in the 80s, 90s, and the times we face now. I mean, it's pretty clear to me that science is leading the way by saying, do the things that will save your life and save the lives of others around you. Wear a mask, wash your hands, keep social distance. You know, don't have big parties right now. Don't gather inside in big groups. All those things found a parallel, I mean, are parallel to what we went through in the 80s. Like, you know, they closed bathhouses. They closed some parks at earlier hours. I mean, there were lots of social changes in the community, but there was growing awareness. And you look at where we are now, 40 years later. As my boss said at that time, you know, we couldn't put a program on the air without people who are gay. It's not just those people, it's all of us. And I mean, I think that's a lesson for today as well. It's not just those people who are gathering in large groups or those people who aren't wearing masks. It's all of us. And until all of us find ways to not get COVID, all of us are going to be at risk. So it's not just me and then you over there. It's why they have the term public health. It's a community, a global community of people who are potentially at risk for getting COVID. It's all of us. It's not just I, it's we.